Okay, so we'll quickly see the Canadian Task Force recommendation, um, what we have did so far. So for the colorectal cancer, the asymptomatic adults age 50 and older who are high risk, right? Adults are at high risk if they have at least one of the who are not at the high risk of colorectal. So this is basically for the general population. But who are high risk population? Previous CRC or edematous polyps, inflammatory bowel disease, signs and symptoms of colorectal cancer, history of CRC in one or more first degree relative, adults with hereditary syndromes and all this. So why these high risk population is important? Because sometimes they just write like the patient is having ulcerative colitis symptoms they will give obviously, or Crohn's disease, so he is having inflammatory bowel disease. And if they are asking about all the screening criteria, so in the basic screening criteria he doesn't fit because he's already high risk, and this high risk population is not included in the recommended screening, like they have to do like right away diagnostic stuff, right? So that's why it is important to know the high risk population. Those are not included in the recommended screening. So if the age is less than 50, no screening. 50 to 59, FOBT or FIT as we have seen, or flexible sigmoidoscopy. So 50 to 74 years, and then 75 plus. If the patient is interested in screening, discuss options and help them reach a decision, but it is not routinely done. So that is basically for the colorectal cancer, in which we have to remember the high risk group, because usually they mention these to differentiate it from the other one. So now
Uh,
the
Excuse me, where I can find that page of column?
sorry, you cannot see the screen.
Yes, but yeah, I
Oh,
can see
these,
it, but
yeah, so these are all the Canadian Task Force guidelines. So if you go to Google, you type Canadian Task Force, so you can see all the screening there. And also, Dr. Kaina's channel. So she has uploaded all these screening in her channel. So you can just see from there too.
thank you.
You're welcome. So the next one is the cervical cancer. So who should be screened for cervical cancer? So clinician must recognize that appropriate of recommendation will vary according to individual needs, values and preferences. As we have seen in the chart, LSIL. So it can be the colposcopy and it can be the repeat, right? So there is like where clinical judgment and all those things are important. So these recommendations do not apply to the women who have never been sexually active, had a full hysterectomy for a benign disease, had a previous abnormal pap test, a weakened immune system. So the important thing, like it is important to remember who to screen, but it is very important to see which population is not included in the screening, because usually, like in the colorectal cancer, inflammatory bowel disease, or whatever, they can throw one or two those points, and then we will be confused and we will follow all the screening guidelines, but basically those people are excluded from the screening, right? So same here, like all these women who have weakened immune system, so what they can do, they can like give one patient with the condition or whatever, like she is using maybe some, the um, cytotoxic drugs or something like that, that she has weakened immune system. So this all screening doesn't apply to her. Or if she has full hysterectomy for a benign disease, had a previous abnormal pap test, so these things, if these are present, then these recommendations do not apply. So what are the recommendations? 19 or younger do not routinely screen, right? So we know we don't screen in younger group. 20 to 24 do not routinely screen, right? 25 to 29 routine screening every 3 years, because the incidence is more in this age group. And then 30 to 69 every 3 years. After age 30, incidence of invasive cervical cancer increases significantly up to 35. So basically after 30 it increases, while rates of abnormal pap tests decline. Benefits of screening outweigh the harm. So that's why we are also offering the HPV testing after age 30. And then 70 or older, as we have already read it, ceases routine screening only if the last three PAP tests in the last 10 years were negative. So this is the criteria to stop the screening. So this is basically the all the recommendations for the cervical screening. And then the next one was
Sorry, I'm interrupting you. Sorry about that.
no worries.
Okay. So usually, did you notice that in all the screening tests, most of them are they usually stop at the age of 70. If
Yeah,
there is no, I mean, risk factor, or let's say there are three continuous examination. I mean, the PAPs are normal. So, so what is the story behind it? Usually after 70.
I think they are giving.
Actually,
Sorry, go ahead.
in my opinion, usually the 70 age after, because the screening tests usually used to detect the cancer in very early stage, and
Mm-hmm.
if it's detected in early age, at least 5 to 10 years required to
Yeah,
become invasive. So if it's I mean, so after 70 years, the patient usually don't have let's say 5 to 10 years.
yeah,
So
like the
that's
life
why they usually
expectancy.
stop.
Yeah, life expectancy is basically like you
Yeah,
cannot
life
improve.
expenses, you will
It's
not know
already
that.
the patient
We
might
don't
have a
know, but
chronic
how
illness.
much the
That's
life
true.
expenses, but
Yeah,
usually the
yeah,
mean
because
age.
generally at that age the patient usually have a chronic illnesses, and how will you improve the quality of living? I think that's why they are in
Exactly,
like
yeah.
Yeah, that's why they stop.
And I think they have mentioned that point somewhere, like life expectancy and all those things. So that's why they are stopping the. But yeah, that's true.
I've seen people like living like 90 plus in Mountain also.
Yeah,
uh,
yeah.
But
Sorry,
yeah,
doctor, I just
just
want a
talking
question
about the
for the
average.
yeah, I just want a question for the cervical cancer.